Well, thank you. And what I will do is probably cut the talk a little bit short and make sure that we go until 1 and I have time for questions. Does that work for everybody? Okay. Well, I like to start my talk with a little excerpt from one of my favorite books called Killer Smog. The meteorological conditions responsible for London's Great Killer Smog began to develop on Thursday, December 4, 1952. A high-pressure weather system spread across the British Isles, and the system brought with it light variable winds. My cursor is over here. Okay. A high-pressure weather system spread across the British Isles, and the system brought with it light variable winds, dry air, and frigid temperatures. During the night, the valley experienced a temperature inversion. Air near the ground grew colder, and soon it was trapped beneath a little warmer air above. London found itself becalmed and remained so for 4 days and 4 nights. Considerable fog began to form late Thursday evening, and during the early hours of Friday, when the city awoke, huge power stations hurled tons of coal smoke into the atmosphere, and still tons more smoke from millions of domestic chimneys added to the cold, motionless, foggy air. Cars, trucks, buses, and a variety of factories and industrial plants all contributed their pollutants. In a short time, the smog had become massively contaminated with a mixture of smoke, soot, carbon particles, and gaseous waste. Now yellow, then amber, now black. The Great Killer Smog had London in its grip, and by early evening, only 12 hours after it began, the first of the city's inhabitants began to die. The full toll of human life extracted by London's worst air pollution to death was never determined, but by some estimates, the smog killed 12,000 people. Here's an estimate showing acute mortality in 4 days was 4,000 people, and peaks as the pollution peaks as well. We estimate that more than 150,000 others were hospitalized. Now, William Wise wrote this book. It's a short excerpt from a really fascinating analysis of this episode. And I always start my air pollution control engineering class reading this book because it tells you everything you need to know about air pollution. You need to know meteorology, you need to know emissions, and you need to know that that causes health effects. But transformation and transport can also happen to move the air pollution from one source to another. So air pollution that caused this killer smog was particles and gases. My expertise is in particles. So these are pictures of some very common particles. The one on the far right is a PM10 particle, and that's particulate matter with a diameter of 10 microns or less. A human hair is 100 microns, so this particle is 10 times smaller than that, and often you can see it, but it's difficult. We have a red blood cell at 7 microns, and PM2.5 is now the fine particles. And these are responsible for a lot of visibility problems, and this is 2.5 microns and smaller. We have bacteria, and then we have the nanoparticles, which is a virus. Here just as a one single SARS-CoV-2 virus at about 100 nanometers. One of the most important air pollution studies was published in 1993, called the 6-City Study. They investigated the relationship between different air pollutants, like the gaseous ones, ozone and sulfur dioxide, and the particulate phase, like sulfate, particulate matter, PM2.5, or total PM. And they found that people living in the most polluted city, which was Steubenville, Ohio, in this study, were 26% more likely to die than those living in the least polluted city of Portage. And it's a remarkable linear relationship. As a scientist, you see that data and you just think, okay, this is really important. And this is what we got started to monitor and regulate PM2.5. We now know that there's no safe level of PM2.5, even down to 1 microns, despite the fact that we do have regulatory standards higher than that. Here are the short-term health effects and the long-term health effects of breathing air pollution. We have headaches, skin irritation for short-term, and we regulate short-term exposures with an hourly average of making sure it gets no higher than 35 micrograms per cubic meter. And then the long-term health effects is a 1-year average, including cancers and morbidity and mortality, and we regulate that at 12 micrograms per cubic meter. Okay, so well, how is Colorado doing in terms of its air pollution? These are the data for the PM 2.5 for the long-term average. So on average, long-term PM 2.5 is below the EPA regulated level of 12. So, you know, that's good news. And we have pretty good PM 2.5 levels. However, we can't always say that our short-term PM 2.5 meets the standard. So for example, in Longmont in 2021, the max 24-hour PM 2.5 was 68. So that's about twice the standard for the EPA. So that's a little bit too high and could cause acute health effects. And how are we doing across the United States? Well, you can kind of see on the west, it's a little bit darker yellow compared to the east, which is quite interesting. But it's roughly below 50 micrograms per cubic meter. So in our country, you know, the PM 2.5 is fairly reasonable. When you start to travel, you start to go to developing countries, you start to realize quite quickly that they have a very significant air pollution problem, 3 to 4 times this. And we saw in China, air pollution upwards of 500 micrograms per cubic meter. And Denver became known for its air pollution more than a century ago. And it's one of the issues, again, is the meteorology. We lie at the base of the foothills, and so we have inversions all the time. By the mid-1950s, health officials really became concerned about air quality and received over 1,200 complaints about the air pollution. And Denver's looming air pollution actually became famous and became well known as the brown cloud. I think this is really one of the only situations where the air pollution got its own name of the brown cloud. Combustion causes about 80% of this cloud. So we're talking cars, you know, combustion from power plants, etc. And it peaked in the 1970s and 80s, but I actually have seen that it's coming back. So again, we do need to be careful of our brown cloud. And most of you do know or may know that our real problem is ozone. We continue to be hammered with EPA non-attainment issues with ozone. So these are some sites where you can actually investigate your own air quality. And if you want to write this down, or I can give you these sites later, you can plug them into your smartphone or your computer at any time and think, okay, I'm going to go visit my daughter in Chicago. What's the air pollution? Go to the Air Now site. This is all EPA monitored in Chicago or all across the United States, and you can see what the air pollution is. Feel free to do it now if you want to. That's totally fine. This was sort of a group activity. If you're interested around the world, the WAQI.info shows you all across the globe, and these are crowdsourced sites. So even, for example, if you had an air monitoring station in your backyard, you could put your data on this website. So that's always fun to do. I'm going to tell you a little bit more about me because it does set the context of air pollution. I like these 2 photographs of Southern California where I grew up. These are before my time, but they were my father's time when he was going to medical school in Pasadena. And he would tell me the stories of the open windows in his classroom, and the smog would waft into the classroom and block the chalkboard so he couldn't actually see the professor talking. It was so thick. And you can see this by this picture on the left. And I like this picture on the right because it shows that yes, masks were still in fashion, you know, back in the 1950s. And that they were important for an air pollution issue. So when I went to high school in Loma Linda, California, and I graduated in 1982, we had over 150 unhealthy air quality days, and we were routinely sent home early from school to stay at home and not not exercise or not do sports. But you know, seeing in 2021, we have like one unhealthy day. And this is a real testament to engineering, air pollution engineering, and also good sound policy by the California Department of Public Health and Environment, and even federal policy at the EPA level. So that's a real accomplishment. I'd like to switch now to the very first topic of my research career, which was tuberculosis. I started working on this in the 1990s because there was a resurgence in tuberculosis. There were multi-drug resistant strains causing a lot of problems around the world. Even today, we lose 1.6 million adults around the world to TB. And this is mostly in developing countries, but it's still a really significant problem around the world. So this lung on the right has a tuberculosis infection. And we called on the engineers to help because drugs weren't working. We couldn't figure out where the TB problems were, and we needed to call in the engineers to help supplement our approach to solving the TB outbreaks. It still happens. Even last month, there was a tuberculosis case at a Denver high school. And in 2011, there was a drug-resistant case in northern Colorado. So it does pop up now and again because of travel, and it's a pretty difficult bug to beat. But it is spread from person to person through exhalation of airborne bacteria at this. Now, this is a diagram that a colleague of mine drew for a paper we wrote in Science about the airborne nature of COVID. But it applies to tuberculosis, where if you're standing near to the person who's infected and they're talking or they're singing, you're gonna be exposed to a really high concentration of airborne bacteria or virus. As you move away, the concentration goes down, but you still can breathe in these airborne particles depending on their size, the airflow. We even think that a 100 micron particle can be carried on an airflow that's pretty strong across a room, causing an infection. So this is the principle that I started my research on, and I was studying air cleaners and germicidal UV. I'm not going to talk about germicidal UV today. It's a very, very powerful technology for high-risk settings like jails, hospitals, homeless shelters. Even we've seen it in schools and daycare facilities. But the thing that we can talk about that all of us probably have or have heard of is an air cleaner. And an air cleaner works by pulling air through a filter with a fan. It's very simple. And the media is like a pressed fiber, and it can remove all the particles from the airflow. So if these particles are carrying virus or combustion particles, they will improve the quality of the air in your house. This is the mechanical filtration efficiency of a filter. So I call it mechanical because it's a physical process that's happening. It's based on physics with particles. And on the left, the particles are removed by diffusion. So these are the little particles. It's Brownian motion. And the bigger particles are removed by impaction and interception. And that dip in the middle is where it's hardest to physically remove these particles. It happens at 0.3 microns. But a HEPA filter is 99% efficient at 0.3 microns. So it's really basically 100% efficient at all particle sizes if you get the particles to go through the filter. Your lung is the same. This is the lung filtration efficiency. Your lung is least efficient at 0.3 microns and most efficient at both the small and the large particles. They get removed in your tracheobronchial regions and in your lower airways as well. So you can think of having a mechanical air cleaner just like your lungs are cleaning the air that you're breathing. I had a student project. This was at the start of COVID. This is when my class first went, you remember that March 2020 where we all went remote. We had to do all our projects. I said, okay, well, you're going to build me one of these air cleaners that we're talking about. And I actually think this might have been in the fall of 2020. where she built this air cleaner and she ran it in her apartment and she cooked herself this chicken dinner 3 times. Now these data are probably a little bit too difficult to see with the lighting in this room, but I want to highlight these 3 peaks when she cooked. And this happens in your kitchen every day as well. All right, so you cook and your PM 2.5 gets up to 178 micrograms per cubic meter. And then it comes back down. And then it peaks again at 77 and 68. Every time you cook, it peaks like this. Yeah.
Did she cook with gas or?
I think her stove was electric. I'm not positive. But let me comment on the gas issue. The gas is a significant issue, but it generates nitrogen dioxide. So I'm not measuring it with this monitor. Yeah.
Was the cooking, do you have an exhaust fan?
Yeah, no, she was not running her exhaust fan.
Oh.
Yeah, she was not running her exhaust, which is critical, right? As you know. So when you run an air cleaner, because she lived in an apartment in the United States, for some reason doesn't think people who live in apartments should have exhaust hoods over their stoves, which is ridiculous. But it's mandatory in Europe, but here it's like, they don't even put them in most houses either. So when she runs the air cleaner, the PM 2.5 peak only hits 15 micrograms. So it is below the EPA short-term standard of 35. And so it's a very effective tool at helping her keep her air pollution reasonable when she's cooking. So I'm going to fast forward 20 years when the pandemic comes, and I'm going to take us back a little bit. And I know for me, it was a very difficult time in my life and very traumatic for many Americans and many people around the world. So I'll try not to dwell on it too much, but because I had started my research in tuberculosis mitigation and control, and I was an airborne infectious disease expert, I was called on to help support the effort to understand COVID and to figure out how to keep people safe. But I was like everybody else in December hearing about this flu, and then in January hearing they were locking Wuhan down, and then in March realizing cases are now starting to show up in the US. And everyone is trying to figure out what is happening. Well, the CDC and the WHO were telling us it's surfaces, wash your hands, be careful what you touch, right? But I saw this newspaper article where we got that Midtown lawyer first case in New York getting COVID. And I read the article because I couldn't believe that the neighbor who drove our bus to the doctor's office also got COVID. And I thought, okay, I know what it's like to drive a car. I get the person in, I drive the car, they get out. Like, how would I then get COVID if it was surface mediated? Like, he didn't touch my steering wheel. Like, what's going on here? And it really was confusing to me. But still, the CDC is telling us it's surface mediated. So everyone's still washing their groceries and putting their boxes outside and, doing all of this stuff, right? And then a choir decides to go ahead with their rehearsal. And 80% of the participants got COVID and 2 people died. And this is late March 28th. April 2020, April 1st, 2020, we write an email to the WHO saying, we are aerosol scientists, we are experts in ventilation, air quality, environmental health, virology, microbiology, and buildings. We see that this is airborne. We're afraid that you don't notice that it's airborne because you're telling everyone to wash your hands and disinfect your surfaces. So we would like to meet with you to tell you why we think this is the case. Well, they did immediately get back to us, but their response was, you're aerosol scientists, you don't know anything about infection control. And they basically blew us off for 1.5 years. When they finally just agreed quietly that December 2021, it's airborne. Okay, so meanwhile, between March and December 2021, the pandemic is is just killing so many people, and it's a disaster. We're trying with a grassroots effort to tell people what to do to keep safe. Masks, open windows, you know, this kind of messaging, which I'm sure you heard. And so what we did is our first effort, and now our group of 36 scientists have now published multiple articles, including one that just came out in Clinical Infectious Diseases, documenting our experience with the WHO, saying, this is what we tried to do. We wrote a paper about it. It was rejected twice. We finally got it published on airborne transmission, the whole history of our experience being shunned from the scientific community about COVID. Because I'm an engineer, I like to do an analysis. So we did an engineering analysis of the Skagit Valley outbreak. This is the coral choir outbreak that we modeled, and we assessed the event. So what we did was we built a model, and we said, well, when the choir rehearsed, we knew it was 80% effective. And then we tweaked our model to say, well, what if we knew that ventilation would help? What if we knew that air cleaning would help? What if we knew that wearing masks would help? Which we should have known, because we knew about SARS-1, we knew about tuberculosis, we knew about measles, we knew about the Spanish flu. We should have known better. Shame on us, right? And so if you run ventilation, air cleaning, shortly rehearse and wear a mask, you can reduce your risk by about 50%. Therefore, we came up with the idea, it's a layered approach. You have to do it all, because this virus is serious and you're not going to get your risk low enough, so get down to below 10% by doing all of the previous indoors. And then I'm just going to share a few of the other things that I contributed in the pandemic is this video. So if you haven't seen it yet, I made it with my daughter, who was 14 at the time, and Professor Vance, who's a professor in our department, because we wanted to make it simple for people to understand how this transmission can happen with an airborne virus. So this is a video we made. It has, you know, here November 2020, it had 24,000 views. And so we're hoping that, and lots of children learned from what was going on. We also put together an air cleaner tool. So I did this with my colleagues at Harvard, where you can, if you need an air cleaner for your office or for your school, I use this with Boulder High School. I use this with some schools around Boulder, where you put in the size of your room, and then it can help you figure out how many air cleaners or what size of air cleaner you need. Because you can't just go and buy, I can't put one air cleaner in this room and expect it to do anything, because this is a big room. Right, so I probably would need 5 or 6 standard size air cleaners for this room. And then in the middle of the summer of 2020, I got a phone call from two individuals responsible for music education. Dr. Mark Speed is the band director at Clemson, and James Weaver was the National Federation for High School Associations for Music. So they said, I've read your articles about aerosol transmission. Do you want to help us save music? Because they were very afraid that we knew choirs were going to transmit virus. What about choirs in school? What about bands? What about all of these kinds of musical activities? So we put together a project with CU Boulder and University of Maryland. This is a video of singing with and without a mask that Jean Hertzberg from Mechanical Engineering made with one of our singers here at CU. You can see the airflow here. So this is just the flow of the air, differences in density, but that also can carry virus. Now we do the mass. You can see a little bit of leakage around the mass, but nothing's coming straight out towards people. So with this information, we also decided to mask instruments. And these are aerosol measurements in our chamber, and I just have a couple more slides and then we can have questions if you like. But in the chamber, we would have my student, who was a clarinet player at the time, mask and unmask her instrument. And so the mask is on the bell. When it's not there, the red peak shows that the particles are coming right out of the bell, because those are aerosol measurements. And then with the mask, there's no peak. So this is a repeatable experiment, and we also measure CO2 to help us understand the respiration impact of playing instruments. So we worked very hard this summer of 2020, and we put together some recommendations for schools to remain open so that their music programs could stay afloat. And these are our recommendations: the layered approach with masking, ventilation, spacing, shorter time indoors, practicing outdoors. And we did a survey of all the programs that use this approach, and we got reports of no transmission in any classroom, and many, many people thanking us for helping to keep their music programs alive in the schools. So we are very proud of that work. So just in conclusion, COVID was a really wicked problem. And I know many of you have solved many wicked problems in your lives. And climate change is our next wicked problem that that we need to really tackle, right? We need a big interdisciplinary team. It can't just be an engineer, it has to be a virologist, it has to, I'm talking about COVID, but for climate change, we need a big team. And we also need to go into with a precautionary approach. The United States doesn't like doing precautionary approaches, but we need to be doing that more in the future. It means that if you come to me with a new product or a new chemical or a new fuel, I need you to tell me first that it's safe before I let you get that chemical into everyone's homes or into everyone's lawn or into, the atmosphere, because it's what powers the cars better. Oh, we should have put lead in the gasoline because it makes the engines run smoother, but we didn't do the precautionary principle, which is that means everyone will be exposed to lead, and now you'll be poisoned with lead. So I think this kind of approach is really how we need to be moving forward. I don't know if we'll ever get there, but I'm just going to conclude there because I know it's 1 o'clock, and I'm happy to talk about any of my other air pollution experiences or answer any questions. But thank you for your attention. Yeah.
With the CDC thinking that it was all surface, what was the problem? Was there a political problem with the CDC, and also you mentioned WHO?
Yeah, I think it was completely political, and I don't think they've been completely transparent in why they were so adamant that it wasn't airborne. I'm not, so I definitely think it was political, because of very, very many scientists understood that it was airborne. But for some reason, the infectious disease docs that were controlling the CDC and WHO were not agreeing to that approach. And I think it was political, and I think it's just too bad.
Well, your question, I guess the question is, what was their political gain by not recognizing the true cause?
Well, some of the excuses that I heard was, if we told everyone it was airborne, then there would be a big panic, and then there would not be enough masks, and then there would, it's like, why are we overthinking this problem? Like, if we know it's airborne, we will rise to the occasion and do what needs to be done to protect our communities. But saying we don't want to tell you it's airborne because that will scare you, and then you might need a mask, and then you won't have a mask because everyone will be buying the masks. And I mean, it just made no sense to me. And that's the kind of stories we would get.
Are you saw the same thing at WHO as CDC?
CDC was tough, right? Because they were sort of needing, Trump was acting all like it wasn't airborne, and it was complicated with the CDC in terms of, I think, The WHO, I think, was a little bit separate issue because,
Trump said in February 2020, in an interview with, anyway, he said in an interview, which was, transcript was released much later, that it was airborne. He used that.
no, that was WHO, that was the leader of WHO who did say that. Well, I know the leader.
No, I'm saying Trump said it, and I assume that he got that from CIA rather than CDC.
Oh, maybe so. Yeah, maybe so. It's complex. Yeah, David.
What role does the antipathy towards vaccination play in all of this?
I don't think that came in, the anti-vaccine sentiment didn't come into it until much later. I don't think that was at play here in terms of trying to identify being airborne. But the hard work in getting that vaccine done so quickly and so effectively, a lot of people just didn't understand how that could be possible and then became fearful, I think, of the vaccine. But I don't think it played into a role at the beginning. I mean, we have a vaccine against tuberculosis, so most of the world is vaccinated with BCG, but we don't vaccinate against tuberculosis in the US because we use the BCG test to see if you've had tuberculosis. And we just hope that we have it under control here and not that you won't get it. But my student who worked on my TB project was from China, and he had been vaccinated with BCG against tuberculosis, which was good because we were aerosolizing BCG. so yeah.
Did you ever enter? Go ahead. We're fighting on the backwards.
Oh no.
The precautionary principle, I was the US science officer to UNESCO for a year at the State Department.
Great.
And I tried to get the US to use precautionary principle because Europe generally does. It's exactly as you said, it's like in any statistical testing, what's your hypothesis, whether it's safe or not, and it's so biased depending on that. So we use this idea that it's safe unless proven significantly not. Whereas most of Europe says if it's changing, if there's a lot of uncertainty, and if the impacts can be irreversible, then we should use the precautionary. It's not optimal from a mathematical sense, but it's certainly a way to go. And it's tough in the US because everything's kind of free enterprise until it's proven in this industry.
Exactly. Yeah, I'm glad to hear that you tried to push that precautionary principle forward in your work, and that we do see other nations doing that, which I think is great. Yeah.
I just comment on the problems you talk about. I see all the same problems with respect to wireless and the effects we're seeing at low levels of weak radio frequencies and magnetic fields. Under some circumstances causing problems, in other cases not. But all the same issues you raised are ones we run into.
Oh, interesting. I do get that question a fair amount about, because I'm an environmental engineer. Everyone's like, well, what do you think about the wave, the energy from the phones and all that? I have not yet seen a well-published study showing.
Oh,
Yeah.
I could spend an hour on that.
I think we should have a good time. I'd love to hear that.
I can tell you quite a little bit in a few minutes sometime.
Good. So I have a question for all of you. Do you all have an exhaust hood over your stove? Yes, awesome. And I hope you use it. Most people have one, but they don't actually use it, or they don't know that it doesn't exhaust outside. Because, for example, when I moved into my house, I had a microwave that had an exhaust, but if you open the cupboard, there's no vent duct going outside, right? So you have to retrofit it to make it go outside. And so that's very important. I always finish my talks with, make sure you have a hood in your kitchen, make sure you use it, make sure it goes outside. And if it doesn't, you don't have one, like an apartment like my students, use an air cleaner hood, open a window, right? Yeah.
So it's funny because you know when you microwave, when your oven is not bent outside. Of course, every time cooking, putting something in the oven or in the microwave, then you look at the top of the stove and it's like covered with this little stuff that you know really got. Because it's really bent right there.
Yeah.
And then you know you're breathing.
Yeah, yeah, and cooking itself generates a lot of toxic pollutants, like you saw, which is why we use source control, which is a really strong control tech approach in engineering. Like, control the source, like take the pollution out, right at the source, right? Run your hood. But then the gas stove adds nitrogen dioxide, which is a respiratory oxidant. So you've got respiratory oxidant from your gas, and then you've got particles from your cooking, and formaldehyde peaks as well, and other volatile organic compounds. So I'm just always telling people to make sure they cook, but they cook, you know, safely. But anyways, thank you so much for your interest and your attention, and I really appreciate it.